Hi, everyone. This is Chapter 3 Ethical Issues in Counseling Practice, Part 2 for Counseling 4500. All right, now let's talk about ethical issues in a multicultural perspective. Do you think counseling is culture bound? Hopefully, you're going to say yes, it is, right? Because it depends on everyone that is involved. That means you, your culture, but also your client's cultures as well. And there's going to be a lot of it, right? And then the ones that we talk about in broader terms are individualistic cultures and collectivist culture. So when it comes to individualistic, it's kind of more Western, more American, which is we are going to be competing for ourselves to win. First place is one person, right? Whereas collectivist is team oriented. So we might not make a decision without talking to everyone in the family, right? So for there, then we benefit each other, we help each other grow. Obviously, in America, we're kind of a combination of either those two things, either separately or a combination. So there might be even three things, right? So it really does depend. And this is why it's so important as a counselor to get to know your clients, to understand exactly what their value system is when it comes to this, when it comes to their culture, and then work with them from there. All right, ethical issues in the assessment process. Some frameworks rely on assessments for planning treatment. Assessments help the therapist understand past and current functioning. So, assessment is just a fancy word for basically tools that will help you understand your client. It could be a test, it could be a survey, it could be an interview, whatever it is. All right, assessments. Evaluating the relevant factors of a client's life to identify themes for further exploration. So it might be something like an assessment for their cognitive abilities, right? Or there's an assessment on how much weight that they can lift that might be related to vocational work, right? So it's all these different things depending on what it is. We just want to make sure that we understand that component that is part of the therapy. That's so important, so that we can use it to help them achieve their goals. A diagnosis is identifying a specific mental disorder based on a pattern of symptoms. Once there is a diagnosis, clients and counselors can establish goals and create a treatment plan. So, diagnosis. So, let's say a general one would be, let's say, autism, right? Once we know that this person has autism, then we can now start to work on areas that we might want to target, such as social cues or something like that, right? So again, all of this is talking about is understanding this person and helping them. For some therapeutic frameworks, assessment and diagnosis might not necessarily be as important, but it doesn't mean that you don't do it then, right? So you don't talk about, or you don't talk about it. And the reason why is because you do need to for insurance purposes, because insurance is going to go, well, why are we paying for therapy? Right? And you need to explain to them what's going on. And that might be so that you might have to tell them what the diagnosis is so they understand the reasoning why they're paying for all this stuff. But you might not necessarily make it a central theme when you are working with your client and talking about them, is, not focusing necessarily on just their diagnosis, and that is it. And we'll talk about the pros and cons for that later on. All right, in the U.S., American Psychiatric Association, the APA, there's a Diagnostic and Statistical Manual of Mental Disorders, 5th edition. I believe there's a text revision now, but this is it. So this is a book that we use with a list of all the mental disabilities that we believe exist out there. It is a very American thing to use because the rest of the world uses the thing called an ICD, or International Classification of Disease. And that one actually has everything, not necessarily just mental health stuff. So just to let you know that in America, we use the DSM-5 for now, right? And it can get updated to the 6th sometime in the near future. All right, some frameworks will reject the idea of a diagnosis and see it as harmful. Examples why? Well, here's the thing. For some of it, it might be gender specific. Here's something that's going on. So, depression might be diagnosed with women a lot more than with men. Why? Right? Part of it is maybe women are under certain types of stressors that causes them to be depressed. Let's say that they're expected to get married and have children, right? So you might have clients who are coming in who are so upset, but those are societal expectations, not about her herself, right? And so with that, this might be the reason why a diagnosis of depression might not necessarily be helpful, because it's really the society that is causing all of this. It's not really her, right? If we didn't have these expectations where women had to get married and have children, or the expectation of that, right, then women might not necessarily even be depressed at all. So that becomes an issue right there. So that'll be one example, but we'll discover and talk more about different ones as we go through all the different therapeutic frameworks. All right, ethical aspects of evidence-based practice. So evidence-based practice, again, right there, shows that there's evidence, and this is why we're going to do it, right? Because we have evidence that shows that this works. So integration of the best available research with clinical expertise in the context of patient characteristics, culture, and preferences. So when we ask you all to do journal article research, that is other people's research about specific topics, right? And these are usually done as a group of people. It's also been approved by, let's say, a university or a research lab or something. So there's a lot of people involved for this research to be published and to be agreed upon that this is helpful, right? So this is why we typically do trust most of the journal articles that we find in our databases. Okay, it's because all this stuff has gone through a huge amount of vetting before it becomes accessible to all of us. So why is that practical, right? And why is this all ethical? It's because a lot of people have worked on it together and have agreed. So it's like a collective. It's not just one person going, this is the way it has to be, and that's it, right? Because we don't know what is the research that they have done, what is, the background of them, and also, like, why is it that we should believe them? But when it's a collective group of people doing a bunch of research, maybe similar research as well, then we're like, oh wait, there are patterns that are emerging, so maybe we should use this type of intervention for this specific type of disability, or not a challenge, or barrier, or whatever it is. All right, for those who do not agree with evidence-based practice, you can also work through practice-based evidence. So that might be that is a little bit of the opposite way, which is it involves the data generating during the treatment to inform the process and outcome of the treatment. So what that is saying is, let's say instead of using evidence-based practice, we're going to try different things, and as we're doing it, we're documenting it, and then we're looking at it. Does this work? If it works, then let's continue doing this and see what happens. Okay. Typically, I will see people usually doing evidence-based practice, which is the first one, more common, because that means that there's a whole bunch of people who've done work and it looks like it works out. So that's why we believe in it. All right, managing multiple relationships in a counseling practice. Dual or multiple relationships is common. It could be sexual, it could be non-sexual. It occurs when counselors assume two or more roles at the same time, or sometimes sequentially. Sequentially means one after the other. Okay, so dual or multiple relationships are not necessarily bad or illegal, but there are bad ones and there are illegal ones as well. Okay, so do not sleep with your clients. That is considered illegal for the first about 7 or so years. It depends on which field you are in counseling. They might have different years. Okay, so when a client and therapist have multiple relationships, though, ethical issues must be addressed, and that's really true. Now let's talk a little bit about some of the stuff that we might have as multiple relationship. All right, here's non-sexual: teachers and therapists, supervisor and therapist, bartering for goods or therapeutic services. Bartering is just a fancy word for trading. Borrowing money from a client. Do not do that. Providing therapy for a friend, an employee, or a relative. Don't do that. Engaging in a social relationship with a client, which means hanging out with your clients. That's not good. Accepting an expensive gift from a client, and then going into a business venture with a client, which is basically opening up a business together, right? There's really no one way to address how to do all this stuff, but most likely you're going to want to avoid all these things, okay? And the reason why is because it gets a little messy. Think about this. Maybe you're going to open up a business with your client, and then maybe it just doesn't do very well. So what happens, right? Then suddenly there's all these issues, and you also are their therapist, and then how are you going to do therapy if you guys are fighting when it comes to your business, right? So there can be some unethical stuff that's going on. All right, now let's talk about the next type of multiple relationship. Sexual. Having a sexual relationship with a client during therapy is unethical, unprofessional, and illegal. Having a sexual relationship with a former client is unwise, can be exploitative, generally considered unethical. So here is something that you need to think about, okay? Why? There are power dynamics when it comes to this, okay? So let's say that you are their therapist. Now you know what triggers them. So when you're dating them, you can manipulate them, you can trigger them into being vulnerable or whatever, right? And so that's not necessarily considered very good to do that type of harm to your client. However, look into the code of ethics, and then they will let you know how many years after you end therapy where you can both start dating. Okay, I'm gonna just tell you from my own personal viewpoint on this is just don't date your former clients. There are plenty of other people in this world. Okay, I'm just encouraging you to do that, because I will say this: people will talk, people will know, and then they will start talking behind your back about this. Okay, and it's not good. All right, that's all I'm going to say about that. All right, ways of minimizing risk when it comes to dual relationships. Adopt a policy of completely avoiding any kind of non-professional interaction. So a very common one that we talk about is, let's say that you and your client are doing a therapeutic relationship, but you also bump into them at the store, and maybe they are working as a cashier at a store, right? So maybe the first time you bump into them, like, oh, I didn't realize that. But then after that, you might no longer want to wait in line, in their line, if they're the cashier, if there's another line open, right? Or something like that. You want to veer off. And typically in informed consent, you also want to let your clients know, hey, if I see you in public, okay, I'm not going to acknowledge you, because some people in the community might know that I'm a therapist, and I want to protect your confidentiality in the sense of, like, I don't want people to even know that you're going to therapy if you don't feel comfortable with that, right? So I'm not going to acknowledge any of that. However, if you decide to acknowledge me, I will be fine, but I will probably keep it very brief. I'll just say, hi, how are you doing? And then I'll probably take off. So that is typically what happens when it comes to me. I have had coworkers who are therapists who, and let's say we were living in a small town, they will continue shopping at that store, let's say, right? For me, I might just go home and come back another time. So it does, again, depend on the specific person, the therapist, on exactly how we interpret it, right? Because let's say my friend might say, well, I'm just, getting a cashier thing. I'm just paying for my stuff and then I'm leaving, right? But for other people, they might go, well, I don't want my client to know what I'm buying. And stuff like that, because now they might know a little bit more about me, about things that I don't think they need to know. And then that becomes, another level, right? But again, it does really depend on each person. All right, establishing personal and professional boundaries. So there is a word called boundary crossing. And it is kind of in the same, it involves kind of the same thing as boundary violation, but they're different. Okay. So boundary crossing is a departure from commonly accepted practice that could potentially benefit a client. So attending a client's wedding. Okay. So let's think about this really quickly in this scenario so you understand. Your client came to therapy because they were having relationship issues, and they're so sad and frustrated about the fact that they are single and they haven't met anyone, and they want to get married and settle down, right? So for them to find someone and then get married, that might be something where you can attend the client's wedding and it'll be fine, right? Because that was part of the goal, right? Here's some advice though, okay? When you go to the wedding, dress professionally at a wedding. Don't dress in a skimpy outfit. Do not hook up with their friends. Do not, cause a lot of scenery, a scene or anything like that at the wedding. You might give them a little card that says congratulations, and then you can leave. You don't necessarily have to have the reception, go to the reception or whatever, right? Be very humble and tasteful, or be very demure, right? Very mindful. Whereas there's boundary violation, which is serious breach that harms a client and is therefore unethical. So you do not want to do boundary violations, okay? And that could, because you might be exploiting that client, and that's not necessarily as good. So those are two different things right there. Let's say your client, the goal was to graduate and get a job. So they might invite you to a graduation, their graduation. So you can go do that as well, right? And then of course, give them a card that says, congratulations, I'm so glad that you're able to achieve the goals that you had set out to achieve, you know, and all that other stuff. That's always really nice. And then also sometimes at a graduation, they might not have a lot of family and friends around. So you being a support there is really good. Just don't draw it out and cause a lot of drama and stuff like that. So boundary crossing in that way is fine. And then boundary violation is when it becomes a really hurtful thing, unfortunately. And that's something we want to avoid. Okay, that is the end of this specific chapter, chapter 3. See you later.